Today we're going to see about the signs and symptoms that seen in a patient who has been presenting with ureteric colic. Ureteric colic is more common presentation in patients, and this has some obvious significant signs which helps us to differentiate this between the other conditions very easily. So if you see the signs, the kind of pain that occurs in ureteric colic is a type of colic pain. That colic pain that that's felt in the loin area, and this pain will be radiated. And the radiation of this pain is mainly to the tip of the penis in males and to the labia majora in females. So with this, if a patient is having a loin pain and it is being radiated to tip of the penis, that could be directly, we can come to a conclusion that is something related to ureteric system, and most prominently it's ureteric colic. Earlier we said it's a colic pain, so it increases and decreases with time. It's not going to subside at all. Yes, the pain increases then decreases, but there will be a pain in a baseline. It will not reach zero. The patient might get relief of the pain, but basically the patient is going to feel a pain, a baseline pain, a constant pain for all the time since he or she had presented to hospital. So the next feature, other than the characteristics of the pain, the patient will present with hematuria. The kind of hematuria that the patient will get here is really episodic, and what kind of episodic means that the patients had initial episodes of hematuria months ago. Maybe it can be associated with the pain that earlier we has discussed, or cannot be associated, and intermittent episodes of hematuria will be another complaint. And also, if you see the patient will look very anxious, very sweaty, and the patient will be restless as well. The most of the many patients who presenting with ureteric colic will roll on the bed. If you admit the patient and take it to the ward, if you ward and keep the patient in the bed, the patient will eventually roll on the bed due to the pain. Yeah. So the patient will be very restless, very sweaty, and very anxious because of the pain. And many times the patient will vomit. The patient will become nauseated and vomit because of this kind of severe pain. We already seen that hematuria is a feature. The another feature is like a dysuria. The patient will complain of pain while urination. Sometimes hematuria can gives a little bit of irritation, but this time if the patient get infected, the strangulation of urine happens, and that became infected, the patient will present with dysuria, pain while urinating.